Okay.
That was on
Under
camera.
under previous business, can we get a motion to approve the previous meeting minutes?
Second.
By Gary, second by Brian. All in favor? Any opposed?
Aye.
Number 1, resolution number 336, I understand is being tabled. Is that correct? Yes?
Is that the styrofoam? Yeah.
Okay, thank you. Your current business, number 2, authorizing agreement with Care Transitions Network for people with serious mental illness and amending the 2017 budget.
Good evening, Mr. Chairman. Both of these requests this evening are somewhat related. The first one reflects changes that are happening in the healthcare field, and particularly in the behavioral healthcare field. I've mentioned to you before, there's a movement towards behavioral healthcare coming under the auspice of managed care. Within the next 3 years, we're going to be transitioning from a fee-for-service system to a value-based system where people will be paid for obtaining results, not just for coming to visit a doctor. This particular request is an agreement with the National Council for Behavioral Health and the Care Transition Network. It's the result of a federal grant. 7 counties in New York State have received this grant. It's a technical assistance opportunity for the next 3 years to work towards this total transformation of the system from a fee-based system to a value-based outcome system. The $28,000 is an incentive that they are giving each county based on the number of employees that they have in direct care service. We were identified along with Albany, Rensselaer County, Cortland, Orleans, Seneca, Sullivan, and Cattaraugus. And again, it's money flowing from the federal government to the New York State Office of Mental Health and the Care Transition Network. So we're requesting to enter into the agreement and to amend the 2017 budget.
Okay, any questions, Joanne?
So I see that the consortium that's kind of the operating entity includes 2 hospital systems that are downstate, the Montefiore Medical Center in Northwell, which is North Shore,
Right.
reading. So do they subcontract with providers in each county? So in other words, that organizing entity then subcontracts for the actual provision of services? Is that how that works?
Well, I'm not sure how to answer that question. That consortium, we're going to be dealing with the New York State Office of Mental Health in the upstate area and the Care Transitions Network. The Montefiore folks and the, what is the other one,
Northwell.
Yeah, they have not had really any contact with us, and so I'm not sure what they're, I think they may be dealing with some of the downstate issues. I'm not really sure.
Okay.
Sorry about that.
I'm sorry, any other questions? Mark?
Thank you, Mr. Chairman. Are you okay with this? This seems very transformational to me, to go from
Yeah.
fee to service to say
Yeah.
value-based. Of course, this is what I talk a lot about, but the question is, are they measuring it the right way?
Yeah.
And what about other factors that affect the value? So I'm curious what your
I
opinion
was
is.
waiting to present this.
Oh,
because I knew that you would.
Thank you.
So this is total transformation. This is
Yeah.
part of the governor's Medicaid redesign. The goal is to get hospitalizations down by 25% over the next 5 years. Federal government is supporting that initiative in multiple states across the nation. Where we're stuck right now is the debate about what the metrics are. And I'm participating in a number of statewide discussions about how do you prove an outcome. You
Yep.
see me 100 times a
Yep.
year, and I get paid 100 times, but did you benefit from it?
Exactly.
And we're trying to develop standardized criteria and then ways to measure it. So that discussion, I knew we would have this. That's running in the background here.
Yeah, I'm big on outcomes, but I'm also big on having experts like yourself have an important say in how we measure this, not a bunch of politicians, because...
Well, there are politicians involved, but...
Yeah,
there are-
that concerns me. But I'm just curious how much say and other experts like yourself, Doctor, will have in creating these metrics.
Part of what's happening is that on a local level, it's about, in 3 years, developing contracts with local managed care entities. And so we're at the table with CDPHP, for example, preliminarily developing what do you do well? How are you measuring it? What will they accept as a proof that we've done? So on a local level, we're having those discussions. CDPHP is a good example because they're the majority of the Medicaid managed care business right now in this area.
Well, it's important that you have a say in it, and
We're at the
if anything I can do to facilitate that, any of us, I'm sure, you really have to have a big say in it, because you deal with this every day. Thank you.
Thank you, Mark. Joanne?
Just on the, so one of the criticisms on many other sectors who are moving also into BBP arrangements is that, and I work in the home health sector, so one of the criticisms that I'm sort of curious whether mental health is experiencing the same is that what happens in these big mega value-based arrangements is that the money is gobbled up by the big hospital system providers, and folks like mental health, behavioral health, home health, drug treatment programs, community-based providers all get like the crumbs that are left over in these VBP negotiations. Are
Right.
you worried about that?
Yes,
Are you?
and if I could ask, the second request directly addresses that, so can I
Sure.
send that to?
Just a quick question on value-based payment arrangements. So does that mean the payments are going to be more based on outcome, result-driven rather than fees for services?
Yes, it'll be totally based on outcome, and there'll be bundle rates for like a depressive treatment episode will be paid. It's like you're going to your car mechanic, it takes this much time and money to treat a transmission problem. And we have to demonstrate that we can fix the transmission in that period of time. So that's the direction it's going in.
Does that seem worrisome in the mental health capacity where outcomes are sometimes very difficult to measure and maybe progress might not be easily discernible when it actually is happening?
These are all the questions that we and my counterparts of the 57 other county directors are talking about, particularly with chronic illness, when progress is measured very in a limited way. If someone's chronically mentally ill, the goal is not going to be total recovery and functioning. So part of the way we've been answering that question is maintaining someone without the absence of negative occurrences. So maintaining someone at a level of functioning without hospitalization is actually a positive outcome, whereas for someone else it might be never needing medication again. So it depends on where you start.
I may be totally off base here, but in a situation like this where payment is based on value-based outcomes, is there a risk that the people with tougher conditions and tougher situations might get left behind because you might not get paid on a value-based system as opposed to treating patients who might have more treatable ailments and therefore more
I don't think that's off base. I think again, my job and the other county directors around the state, we're the safety net. And so we're fighting for a seat at the tables and to remind people that, a lot of the managed care companies have come to us and said, listen, we don't know how to treat the folks you treat. We need your help because suddenly the governor's told us now we're going to be responsible for this population. But yes, I share that worry. I don't have, yet to be determined how it'll play out. But,
Interesting.
Thank you.
Thanks, Brian. Any other questions? Can I get a motion to move? By Brian, second by Joanne, all in favor?
Aye.
All opposed? Unanimous. Number 3, authorizing the Albany County Department of Mental Health to join the Capital Region Behavioral Health Care Collaborative.
So this, I think, is a good, well, it's connected, and I think it addresses some of the other concerns that were mentioned. So you've heard Dr. Whalen and I think, talk about in recent months the Albany Medical Center district project, the TPS. A lot of acronyms, I know, but it's federal money that's come to the state to push healthcare initiatives. Most of the money went downstate. The money that stayed upstate, most of it went to health, not mental health, and we got the crumbs. And I think most counties have experienced similarly. Department of Health, OMH, and OASIS have come together, and this is the answer to that dilemma. Behavioral health care collaboratives. These are regional networks. This is an 11-county regional network. that will only be addressing the behavioral health needs of that region. We've been asked to participate again because we're a safety net provider. We think there's 2 to 3 years before the transition to total value-based payments occurs. This is a request to be a participating provider, although there's no money attached to it right now because we're 2 to 3 years away from even considering contracts. But again, it's an opportunity to be at the table. 11 counties, there are 40 agencies that were invited across 11 counties. We provide a lot of services, so we were asked to participate, and it seems like a no-brainer to me to be at the table rather than not. We can exit at any time, and after 3 years, we have to demonstrate that we're valuable enough for them to offer us a contract, and that's what we're going to be spending the next 3 years doing.
So at some point, when it's ready to actually negotiate rates, we're gonna have to probably front some sort of fee to be a part of that.
Well, the technical assistance that the first group is going to provide us is about contracting and partnerships.
So you can use that for the,
And there's going to be some complex legal questions. And quite frankly, the other thing I worry about is there are not-for-profits and privates and government in this. This is uncharted territory yet. Whether county-run operations will compete successfully, I'm going to do my best to make sure we do, but it's unclear who's going to be left standing at the end of this.
but if you're part of this
Yeah.
contracting group,
Yes.
your leverage goes way up.
Yes,
as
and
a-
that's why we're asking to be, we were invited in and we want to be at the table.
This is a great idea.
Make a motion.
Motion by Gil,
Second.
second by Joanne. All in favor?
Aye.
Any opposed?
Thank you, Mr. Chairman.
Thank you, Dr. Giuliano.
Thank you, Don.
Thank you.
Motion to adjourn.
Motion adjourned.
Second.